So in this particular case of the 85-year-old Miss Johnson, first question of any laws were violated. There's a bunch of laws violated in this situation. The violation of State Practice Act, the PT must first perform an evaluation before any PTA can decide to do any treatment on that patient. And not only that, negligence is definitely one of the main violations in this scenario, especially after Ms. Johnson fell as well. They didn't take into account that she already had some left side paralysis from a previous stroke, and failure to report or document the incident is definitely a big issue. Ms. Rodriguez definitely could have, she could have waited before she started initiating treatment for this patient. There was no evaluation from the PT, so how do we know exactly what to do? And then, the important thing was the first thing she could have done was to contact the supervising PT, and she could have either, if PT was not available, the right thing to do is to reschedule or delay treatment until the PT has some type of answer for you before you begin any treatment. So Ms. Rodriguez failed to provide any adequate care after Ms. Johnson fell. She didn't, provide immediate first aid. When this patient fell, the first thing she did was scream for help. The daughter came and found her mom on the floor, and that's not what we want to do. We could call for help, but we need to assist the patient first. And another thing that wasn't adequate of her was to report it. Definitely reporting this incident to the supervising PT is very important. That way everything is documented. So in this scenario, question is if there's any reason why Ms. Rodriguez went ahead and started without any supervising PT. There's no logical reason. The only thing is she could have felt, awkward as far as just waiting there until the supervising PT arrived, or she felt some type of, maybe she didn't want to be belittled because maybe she thought the patient would think, oh, she doesn't know anything, she can't do anything. But that's, not a reason to go ahead and start without the permission of a supervising PT. In this case, as far as liability, Ms. Rodriguez is liable for what she did to the patient because she practiced something that's out of her scope. And she started doing treatment with no supervising PT, which, is obviously not allowed. It's not something that we can do. What would I have done differently in this scenario is definitely, if we're already in this situation where we're already treating patients, we're already, working with PTs, we should already know that we shouldn't start if there's no plan of care or, about general supervision, direct supervision, anything like that. We should already know those type of guidelines before starting any treatment for any patient, because at the end of the day, we do something like this, it's going to fall on us. Definitely would have checked the patient's chart and would have seen, if there's any evaluation prior or if she had any, as far as the health history. We could have checked for risk factors. We're doing, Miss Rodriguez was doing treatment that, could affect her, really she really maybe didn't even work for her. She didn't take she didn't chart anything down, and she was just basically doing whatever she could, I guess, maybe to stall for the PT, which is something definitely that we should not do. If no, PT evaluation was found, I definitely would have immediately stopped the session. I could have rescheduled. I could delayed, and if it was too much of a delay, then definitely reschedule. No point in wasting the patient's time. Tell them that unfortunately, PT won't be here today, and move on from there.